The Global Fund strategy is essentially to get control of the three diseases, HIV/AIDS, TB, and malaria. There are a number of important elements in achieving the mission of the Global Fund. For example, one of them is ensuring that we focus on key affected populations in each of the three diseases. But having strong and resilient and high-performing supply chains is also a critical element of achieving the Global Fund's mission. And we are unlikely to achieve that mission without those kinds of supply chains. So we're here today to celebrate the groundbreaking of the new Natpharm Warehouse. I do look forward to coming back on a future visit and seeing the warehouse in place and functioning. But I would just add a note of caution, which is that in order to build strong and high-performing and resilient supply chains, the hardware, the elements like warehousing, is actually perhaps the easiest part. I think it's the software that actually ends up delivering those high-performing, resilient, and strong supply chains. It's the MIS around the supply chains. It's about the accuracy of the quantification and forecasting. It's about the culture of all of the people working in the supply chain. It's about the retention, well, firstly the training and then the retention of the staff at all levels of the supply chain. It's about getting the logistics right. It's about getting the right balance between having enough stock, stockouts, and too much stock, so you end up with expiries. All of these things are the really tough elements that we see in countries in terms of delivering strong supply chains. So whilst we're here today to celebrate the warehouse, and that is obviously a critical and important component of the supply chain, there's much else, there's much more work that needs to be done. We stand ready to obviously help the government of Zimbabwe, Natpharm, the Ministry of Health, to deliver that vision of a strong supply chain. And I know a number of partners in this room will also take part in that. So I'm delighted to be here today at the start of this journey. I look forward to coming back in a year or two, I'd say optimistically, and truly seeing all elements of that high-performing supply chain. Thank you.
Natpharm started as government medical stores. The government medical stores were supposed to store all the drugs for the country and other medical accessories. And around 2000, it was changed from the government medical stores to a national pharmaceutical company of Zimbabwe under Section 26. So it became like a private company, but wholly owned by government. And its mandate, like what the chairman has said, you are really supposed to store to buy in bulk, so that it's cheap and cheaper, not only for the public sector, but for the private sector as well. So you're supposed to be really doing that sort of work. So now that you are going to have 22,000 pallets, it's a big warehouse, state of the art, completely air conditioned. Really something to be very proud of. So I want to thank again the Global Fund, because they've made this possible for us. And not only are they doing it for Are, they are also doing it for Mutare, and they are also doing it for Masvingo. So there will be other warehouses, obviously not as large, but in Mutare and in Masvingo. So I want to thank you and congratulate you for really partnering with us to provide quality health care. But you're right, Mark. This is, to us, you say it's an easy part, but it was a difficult part for us, just to put the infrastructure. But more difficult indeed will be to fill in those 22,000 pallets with drugs and medicines. We'll need a lot of foreign currency. We'll need well-trained staff, committed staff. And you're right, there must be a culture so that you know that this one works for Natpharm, a culture. You build a culture so that people who come in there imbibe that culture. So we're looking forward to those things for Natpharm. I'm told we're going to do a groundbreaking, and then I've been also advised that immediately after that, construction will start.
You now follow with your shovel. Yeah. Then you dig.
And the lay is this huge.
You have to hold the break. Hold the break? Yes. You come to hold the break. There we go. I'm going to be it's a strong whale.